Distinguished guests, delegates, colleagues, and friends, welcome to the 51st Union World Conference on Lung Health. Thank you for joining together with us from across the world for this year's groundbreaking event during this unprecedented time. The opening ceremony is about to begin.
Pandemic is not a word to use lightly.
China says the number of people infected by a mysterious respiratory virus has more than tripled over the weekend.
The World Health Organization says most, if not all, countries should expect outbreaks.
Italy, Brussels, Spain, Paris,
Germany,
India,
South Africa,
Mexico, Brazil.
We are struggling to get it under control.
Across the world, doctors say the coronavirus pandemic and the subsequent lockdowns will likely hamper the fight against other killer diseases like tuberculosis, malaria, and HIV.
Together we do have an opportunity to contain the spread and to prevent the worst.
We really need to take the recommendations and the guidelines of how to mitigate the spread of this very, very seriously.
Listen to the science.
Now is the time to listen to the experts. Scientists are our best hope to end the coronavirus pandemic.
We will get through this together, but only if we stick together.
They are the heroes on the front lines, the doctors and nurses who are treating coronavirus patients.
I want to thank all of you. You are the front line in this war against this virus, and we all pay tribute to you.
Praise for these heroes can be heard across the globe as ordinary people break out in cheers from balconies in self-quarantine.
The first human trials in Europe of a coronavirus vaccine has begun in Oxford.
This could change everything.
The final round of testing are showing early signs of promise.
Hopefully we'll be able to start vaccinations in earnest as we begin 2021.
We must join together for our own health and the health of our families and communities.
We will come through this together.
Please welcome Professor Guy Marks, President of the Union.
Your Imperial Highness, Crown Princess Akishino of Japan, President Clinton, Dr. Tedros Adhanom Ghebreyesus, honored guests, distinguished members of the Union, conference participants, welcome to the 51st Union World Conference on Lung Health. I speak to you from Sydney, Australia, and I would like to begin by acknowledging the traditional custodians of the land on which I stand today, the Gadigal people of the Eora Nation, and pay my respects to their elders, past and present. I extend that respect to Aboriginal and Torres Strait Islander people and other First Nations people attending our conference today. In closing last year's conference, I anticipated a challenging year, but expected that we would meet to celebrate the Union's centenary in Seville, Spain at this time. Our plans have gone off track, but frankly, this bump in the road is minor compared to the hurdles placed in front of people around the globe as they deal with COVID-19 and its consequences. I am sure nearly all of you have had your plans and lives upended by the pandemic. 100 years ago, our predecessors came together in Paris to chart a course for dealing with tuberculosis. They recognized the important role of science and research, global cooperation, communication, and civil society engagement in responding to this threat. In 1920, they had diagnostic tests, X-rays and microbiology, but no treatment and only the promise of a vaccine. public health measures, including isolation of infected and infectious individuals in sanatoria, were at the heart of efforts to control the disease. It is remarkable how, as we meet in 2020, we are facing a new challenge with the same tools available to us: case finding, quarantine and isolation, and infection prevention and control. Now, as 100 years ago, the new challenge highlights the value of knowledge generation, exchange, and dissemination, and of global cooperation. Now, as then, we see that health and economic well-being are intimately intertwined. Choosing one or the other is a false choice. There can be no economic growth and well-being without health. Now, as then, we see that leaving no one behind, ensuring universal access to health care, and recognising the close connection between animal and human health are crucial cost-cutting issues inextricably linked to finding solutions. At this meeting, you will hear a lot about tuberculosis and COVID, and the responses of scientists, clinicians, and affected individuals and communities from across the globe. You will also hear about other key threats to lung health: air pollution, smoke from forest fires, environmental degradation and climate change, as well as the scourge of tobacco, other respiratory infections, and the adverse effects of exposures to hazardous dusts and fumes at work. You will hear about better models of care for people with disabling and life-threatening lung diseases, such as asthma, COPD, and pneumonia. It promises to be a diverse and exciting program. I wish you all a successful, fulfilling and enjoyable week at our online conference. In doing so, I would like to extend a particular thank you to the Coordinating Committee of Scientific Activities, led by Dr. KEREN MIDDELKOOP, and the Union's conference team, led by David Jackson, who have worked tirelessly throughout the year to bring you this online festival of science, research, and policy. It is now my immense privilege to introduce Her Imperial Highness Crown Princess Akishino of Japan. Her Imperial Highness is an honorary member of the Union and has been patroness of the Japan Anti-Tuberculosis Association for more than 25 years. For many years, Her Imperial Highness has been cooperating with health professionals, providing encouragement to participants in tuberculosis training programs, and supporting activities of women volunteers in local communities. She has been promoting public awareness of tuberculosis and other health issues, both nationally and internationally.
Your Excellencies, honored guests, distinguished members of the Union, conference participants, it is a great pleasure for me to participate virtually in this 51st Union World Conference on Lung Health. I would like to thank all those who have made this conference possible this year, which has been a difficult period of time for all of us because of the COVID-19 pandemic. I'm also grateful to the numerous professionals with experience in a fight against TB who have been making great contributions in the global fight against COVID-19. The World Health Organization has named 2020 the International Year of the Nurse and Midwife, and I would like to acknowledge the critical role that nurses and midwives are playing in the response to COVID-19. For instance, in the case of Japan, public health centers and public health nurses have been devoted to preventing the spread of the disease through measures such as counseling patients and coordinating their hospitalization. At the same time, COVID-19 is creating an extremely great challenge to our efforts on public health. This is a historic challenge that is affecting every country in the world, and there is a risk that years of progress against TB may be reversed. We can and must prevent this from happening. The Union has a vital role with its members so important in our efforts relating to TB and lung health. I would like to express my sincere gratitude to you, the members of the Union, who must have been working extremely hard to fight against TB at this very difficult time. I'm also very grateful to the Union for disseminating valuable information around the world. You have the knowledge, you have the experience, you have the influence that the world needs right now. I would like to convey my deep respect to the Union, which has a long history of working together against TB and other respiratory diseases, uniting efforts to achieve health globally over the past 100 years. Thanks to the efforts of the past 100 years, we are gifted with so many tools. We are very fortunate to have measures to prevent TB. However, we still have a problem. The problem is that we are yet to fully implement the means that we already have in our hands. The theme of this year's conference, Advancing Prevention, is so timely. I am sure that the conference will be a very fruitful one for everyone. We are also facing challenges related to human nature. Fears and anxieties may feel dangers of exclusion and stigma, which work against proper prevention, diagnosis, and treatment. Smoking continues to be another problem related to human nature. But I know many people, including health professionals and volunteers in civil society, who care for the physical and mental health of everybody, including the vulnerable people. I appreciate their activities very much. Japan Anti-Tuberculosis Association Women's Society, which has been voluntarily carrying out activities to increase public awareness of TB in local communities, is one example. The Union gives us hope. The Union brings us together from so many parts of the world toward the common goal of ending TB. We shall continue our precious task to bring about a healthier world for all of us, for our children, and for future generations. Thank you very much.
President Clinton, dear colleagues and friends, COVID-19 is a stark reminder that the simple act of breathing is fundamental to life and of the devastating effects of anything that takes our breath away, including tuberculosis, tobacco, and air pollution. This microbe attacks the lungs, but its effects are felt far beyond, in families, communities, health systems, societies, and economies. The pandemic has taken a heavy toll on services for many diseases, including TB, with sharp drops in TB notifications reported to WHO from several high-burden countries. This could lead to an additional 400,000 TB deaths this year alone. The pandemic also compounds the tobacco epidemic, with smokers more likely to develop severe disease with COVID-19. COVID-19 threatens to unwind the progress we have made in recent years to prevent and control tuberculosis and other lung diseases. The impacts of the disease itself and the response to it, including stay-at-home orders and other so-called lockdown restrictions, exacerbate many of the driving factors of TB, including poverty, inequality, and stigma. But we cannot allow the pandemic to become an excuse for failing to deliver on the commitments we have made to end TB, tobacco, and air pollution. Quite the opposite. The pandemic is showing us why we must work with even more determination, collaboration, and innovation to meet those commitments. Even as researchers race to develop a vaccine for COVID-19, we already have the tools to prevent, diagnose, treat, and control TB and to help tobacco users to quit. WHO is working with countries to ensure life-saving services continue for people with TB and related conditions, including hypertension, diabetes, asthma, and lung cancer. Many countries are responding with innovative efforts to deliver medication, telemedicine, and care closer to patients' homes. The pandemic will end, but TB, tobacco, air pollution, and other lung diseases will continue to steal the breath and life of millions of people every year. COVID-19 is reminding us all that life is fragile and health is the most precious commodity on earth. Together, we must harness the same urgency and solidarity with which the world is fighting COVID-19 to make sure everyone, everywhere can breathe freely and cleanly. I thank you.
Hello everyone, my name is YVONNE CHAKA. COVID is the crisis of our generation, bringing death, destruction, division, despair, and devastation. It is the biggest global health emergency, which must have a public health response. It has exposed our broken systems of government within countries and globally, across borders. We must urgently press the reset button. We must build back better. But what does this mean? We all have grandparents, granddads, grandmothers, sisters, brothers, cousins, nieces, friends. We all have people that we love. We're all connected by a human family beyond globalization and trading. For an effective public health response, we cannot leave anyone behind. There can be no missing person, no exclusion due to stigma, because every life matters. Everyone is precious. Building back must be based on social justice, where access to healthcare and livelihood is inclusive, more affordable, and more equitable. Everyone needs access to diagnostics and treatment, including vaccines. We must rebuild trust in our governments and systems through collective responsibilities and share knowledge. The need for social distancing cannot be used to stigmatize and victimize people and their communities. There must be greater honesty and integrity in decisions made by leaders. Their decisions must be based on strong evidence using the best scientific results. This must lead to effective policies and restore confidence in our systems of government and decision-making. We must counteract fake news and misinformation. The time has come to reset our values by giving equal weight to health security as we do economic security. People before profit. We must build robust health systems to stop COVID claiming more lives and stealing livelihoods. saying no to collateral damage from TB and other diseases. We must have a holistic public health response. We must find new ways of funding, pricing, and sharing the value of our medical research for the benefit of all, not just a few. We must put access to healthcare at the forefront. Let's together say no to preferential access. We must reignite the spirit of Ubuntu, the spirit of I am because we are in our communities by making them the central core of our common purpose. As a South African growing up during apartheid, I know the importance and values of Ubuntu as a universal bond of sharing our common humanity. We need the spirit of Ubuntu today. No one nation can succeed unless all nations succeed. We have to overcome our differences and work diligently towards our common goal. Together, we are stronger. For you, for me, for our survival, we must demand that global solidarity move beyond an ideology. We must make it an achievable goal through strong political will based on genuine moral and ethical leadership. Ladies and gentlemen, I thank you.
The prime objective of the World Health Organization is the fight against disease on a global scale.
We started giving all three drugs together, and to our astonishment, by being meticulous, we found we weren't getting any failures. Nobody believed us.
On this World Tuberculosis Day, let us reaffirm our commitment to tackle this deadly disease together.
You can't control tuberculosis if you don't control tobacco use.
This is a moment for us all to collectively step up our commitment to ending TB.
Please welcome José Luis Castro, Executive Director of the Union.
Your Imperial Highness, Crown Princess Akishino of Japan, President Clinton, Dr. Tedros Adhanom Ghebreyesus, honored guests, distinguished members of the Union, conference participants, welcome to the 51st World Conference on Lung Health. This is a historic year for the Union, our centennial anniversary. 100 years ago, the Union was founded out of the rubble of World War I, in the aftermath of a crisis on a scale the world had never seen before. Now we are facing another global crisis, one that threatens to destroy health systems and is destabilizing countries around the world. And as before, we are seeing the public health community rise to the occasion. Researchers are developing diagnostics, treatments, and new vaccines in record time. The word health worker has become synonymous with hero. The public health community is a model for the world today. You are showing what it means to put aside our differences and work together for the good of the whole planet. Now is the time for us to stand together and make sure that the world is never unprepared for a crisis like this again. Here in this conference, we have members of affected communities, doctors, nurses, scientists, researchers, government officials, and advocates. It is up to us. Today, we have more knowledge, more technology, more resources, and more connectivity than humanity has had at any other time in history. We have the power to see that the Sustainable Development Goals are not just good ideas that get put aside when crisis arises, but that these are commitments that we have made to each other no matter what. It is up to us. This coming March, we will be halfway to the point when governments promise to ensure 30 million people access to TB treatment. It is within their power to fulfill this promise. Who will hold them accountable? Right now, the tobacco industry is exploiting the pandemic, using it to weaken policies and regulations meant to protect people from tobacco. Who will stand up to them? The people who founded the union were not just thinkers. They were champions of action. Some of them were people whose countries were still in rubble when they founded the organization. Yet they founded the union in a spirit of triumph. They refused to accept a reality where humanity was defeated, whether by conflict or by plague. They knew that all of us are bound together, and they forged ties that broke down barriers and transcended the toxic politics of the time. As we moved into our second century as members of the Union, this is still our calling. We all know it will take a long time to recover from this pandemic, and the world will be forever changed because of it. The question is, in what way will the world change? Let us use this crisis to achieve the most important outcome of all, to see that every human being, no matter who they are or where they live, attains the right to health. It is up to us.
Are these new demands? No. TB communities continue to suffer, and we've had years of protests behind us. There seems to be a failure in understanding and ensuring a people-centered, rights-based response to TB. Stigma continues to destroy the core of people who are seeking care and support. We are losing lives each minute, and the question is, are we serious and willing to end TB?
मेरा नाम मीरा यादव है। मैं XDR टीबी सर्वाइवर हूँ और टीबी एक्टिविस्ट भी। कोविड की वजह से हम टीबी में 8 साल पीछे चले गए हैं। पैंडेमिक की वजह से हमारी टीबी की सर्विसेज काफी रुक सी गई हैं। उन्हें डायग्नोसिस नहीं मिल पाया, उनका ट्रीटमेंट नहीं स्टार्ट हो पाया। कुछ मरीजों को इंजेक्शन बीच में छोड़ने पड़े क्योंकि कंप्लीटली लॉकडाउन था, क्लिनिक बंद थे, DRTB सेंटर्स बंद थे। काफी लंबे समय से हम ओरल ड्रग की डिमांड कर रहे हैं, बेडाकोलिन और डेलामिनेट। तो अगर क्या सिस्टम ने ये दोनों दवाइयां ओरल रेजिमेन में रखी होती एक साथ, तो क्या इस तरीके की परेशानी आती?
The number of times I was told I was going to die was like 3 times. And the numbers of pills swallowed were like 20,000 to 30,000 tablets. If you get all drugs that make you deaf, blind, or disabled for life. This is not fair. It's a TB drug. It works. Fix the patent law so that the drugs can be available to everyone who needs it. Everyone should have access to medication, and those who are fighting, whatever they're doing is very important. I think that everyone must be involved. Scientists, politicians, patients, etc. Like everyone must be involved.
Good evening, ladies and gentlemen. As our former Indian President, late Dr. APJ Abdul Kalam said, difficulties in life come not to destroy you, but to help you release the hidden potential and power. I have been working as a nurse for the past 11 years and have had TB thrice. After a tiring night shift in 2011, an X-ray revealed I had patch over the left upper zone, for which I was empirically started on 4-drug ATT. Then in 2014, while I was doing my Masters in Neuroscience, again I felt the same pain. X-ray revealed patch over the left upper zone. This time I was started in ATT with injection streptomycin. Last year, because of the increasing pollution and repeated chest infections, I wanted to try for better job opportunities abroad. A routine chest X-ray showed consolidation over the left upper and middle zone. The CBNAT report came. I was resistant to rifampicin. I was devastated and really fed up of that long treatment regimen. The first thing I requested my physician this time was not to prescribe me IM injections, because it is too easy to give but too much painful to take it daily. From day one of treatment, I felt life was just miserable. I took 22 tablets plus injection kanamycin a day. From 56 kg I reduced to 48 kg in a month's time. Thereby I decided to go back home in Kerala and restart my treatment. Third month, with all the side effects, I had blurring of vision. I had sleepless nights, crying spells, emotional breakdowns. Neither me nor my family could figure out what was happening to me. I couldn't cope positively. On top of all this, I received a memo from work stating my leave was not sanctioned. So I traveled back to Delhi, where I was posted in neurosurgery ward, where I developed periapical abscess and had to be on antibiotics. With lots and lots of trauma, physically and mentally, I completed my treatment in April 2020. After these experiences in life as a nurse, today I can feel the pain my patient feels during an IM or IV injection. I know how important it is to talk to each patient with love and care and to support and provide information on their treatment. I learned the value of being heard. As nurses, we deserve to get leave when we are sick with tuberculosis. We deserve to get vaccinations, periodic checkup and easy access to treatment. Tomorrow we all can be in the same shoes, so we need to treat our co-workers with compassion and empathy. It's high time to end discrimination and stigma, which I felt badly during my MDR treatment. We need to take care of ourselves so that we can take care of many. I'm really thankful to the whole organizing team of the union and Ms. Riya for this wonderful opportunity. The Missile Man of India completed his quote as, "Difficulties in life come not to destroy you, but to help you release the hidden potential and power. Let difficulties know that you are too difficult." Thank you.
Your Imperial Highness, honorable guests, colleagues, and friends, I am privileged to be part of the launch of this 51st Union World Conference on Lung Health. The theme, Advancing Prevention, really must be a call to action in these days of global pandemics. And we really are talking about converging pandemics here: COVID-19, HIV, TB. Even before COVID-19, TB remains the leading cause of death for people living with HIV. We're not doing enough to find active TB among people living with HIV, missing half the HIV-TB cases each year, and we've really only started to do enough to prevent TB among people living with HIV. And then comes COVID-19. Threats of service interruption for HIV and TB are very, very real. We've already seen them. Modeling with UNAIDS and WHO projects that a 6-month interruption in HIV treatment alone in sub-Saharan Africa could lead to massive losses of lives, 500,000 additional deaths, bringing us back to 2008 levels. We could lose a decade of progress in just 1 year. And so we can't let COVID-19 be an insurmountable hurdle to progress and preventing TB and HIV. After all, we've been overcoming hurdles together for decades. For example, even when multiple studies proved the safety and effectiveness of TB preventive therapy, or TPT, when WHO promoted TPT since 2004, it took decades to overcome health workers and community doubts and to mobilize funding for TPT. And now we've seen progress reaching 1 million people living with HIV on TPT in 2016 and 17, and now 3.5 million people in 2019. Now is not the time to slow down. With COVID-19, the world is now seeing the impact of the hurdles we've only partially overcome over the years. Hurdles to fully achieving hospital infection control and health worker safety, despite clear WHO guidelines and interventions like TB basics to rapidly transform settings. Hurdles to capacity for contact tracing, too few investments in human resources and technologies needed to do it right. And only now do we hear more leaders talking about the challenges of the built environment to prevention. Crowded spaces, lack of light and ventilation, challenges to cough hygiene, things the TB community has known since early in the last century. So I challenge all of us to not lose momentum during this challenging COVID time, but instead to team up and shout loudly, now more than ever, for aggressive investment in these colliding epidemics, in preventive therapy, infection control, health worker safety, scaled modern contact tracing, built environments, and the social and economic supports that people need. To do that successfully, we need communities. Community-led organizations of people affected working for people affected by HIV and TB. Community-led organizations at the governance and policy tables, providing services, and also being watchdogs to verify that what's been promised is actually being delivered. And to do that, they need to be directly financed and fully equipped. Overcoming COVID-19, TB, HIV, and future pandemics requires global solidarity. Together we must develop and equitably distribute combination prevention, treatment, and vaccines to all. True access that prioritizes those who need it most. So thank you, and I wish you all a powerful conference.
As the Union celebrates our centenary, we find ourselves in an exciting time of accelerated scientific discoveries and advances, and yet conversely, also at a time when science is often distrusted and even derided by the public. In the midst of fake news, alternative facts, and even the pitfalls of rapid release of science in the race to be first published, the Union remains committed to a meaningful advancement of knowledge and to science of the highest standard. For this conference, as every Union conference, we have made every effort to build a program comprising of interesting, innovative, and sound science. Every abstract and symposium presented at this meeting has been peer-reviewed by at least 3 members of a 660-strong army of reviewers who have graciously volunteered their time and expertise. The final selection has been overseen by a committee of experts, the Coordinating Committee of Scientific Activities, who are elected by the Union membership and who have worked selflessly to put together the best program. It has been my privilege to work with and chair this committee in the past few years. I must also thank the TB Science Committee, chaired by Professors Amina Jindani and Frank Koblenz, and Dr. Inaki Komis, who developed the TB Science program, which will run within the conference this year. The World Lung Health Conference continues to be a platform for presenting and discussing global scientific research. And this year, the program comprises of representatives from 82 countries across all 7 regions of the world. And the program spans a diverse scope of science. We will discuss updates on SARS-CoV-2, including vaccine development progress, the impact of the COVID pandemic on other health services such as TB prevention and treatment programs, but also how the pandemic has driven innovation, like a virtual platform developed to prevent interruptions in TB treatment. Innovations in other areas such as TB diagnostics, as well as exciting results in treatment shortening options will be talked about. And there are a number of sessions giving consideration to the impact of post-TB lung disease, as well as others talking about childhood pneumonia and asthma. New tobacco products and the challenges of tobacco control will also be deliberated. We know that scientific knowledge and understanding is continually evolving, and even among experts in the fields, opinions can differ on the interpretation of data and the most appropriate next steps. We hope that this year's meeting will provide space for stimulating and rigorous debate that will move science forward to impact the healthcare and lives of people around the world. So I thank each of you for being present to engage in these discussions over the next 4 days, and welcome you to the Union's 51st World Lung Health Conference.
My name is Catherine Marr, and I am the CEO of the Wikimedia Foundation, and I am so excited to join in 2020, the year of the nurse, thousands of practitioners, clinicians, doctors, nurses, survivors at the 51st Union World Conference on Lung Health to discuss the importance of medical health information, free knowledge, and Wikipedia.
How did it come to pass that Wikipedia, this self-organized project that's not even 20 years old, has become a much more reliable place to get COVID information than these big tech companies with obviously huge budgets and huge staffs? And what do you think that tells us about information, this big question about disinformation, information online?
Sure. So I think that it was an unexpected responsibility that Wikipedia took on as being this, not the primary, but one of the primary sources of information during this COVID-19 pandemic. As an encyclopedia, I think we're very used to producing information that addresses biological or natural phenomenon, world history. Being in the midst of an unfolding 7 months and running global pandemic is something that's completely unprecedented for us. But fortunately, Wikipedia has a long history of wanting to really ensure that medical information is as accurate and high quality as it can be. We also have a really long history of being a primary source for people who are seeking medical information. I remember a study came out in 2014 that said that more than 50% of physicians tend to look to Wikipedia for basic reference information, including on issues of lung health, such as tuberculosis and pneumonia, either to catch up with some of the basics of those diseases or to get a little bit deeper into some of the more unexpected areas of how their progression and sort of predominance within a society. So Wikipedia has been around a long time, about 20 years now. And in the area of medical information, I think our editors have an even higher standard for getting it right. We, as Wikipedia, always say, look, we're work in progress, we're imperfect, we're constantly working to get better. But in medical information, given how many people come to Wikipedia on a monthly basis to access that information, you have a cohort of very passionate volunteers from around the world who hold themselves to an incredibly high standard for the quality, integrity, and verifiability of that information.
Yeah, it seems funny because I think one of the things that was surprising when I was reporting about this is that it's almost that the other platforms have taken the view that we have no standards, that free speech means anything goes. I mean, you've watched that happen. It's like that Wikipedia has kind of become a fact checker for Google. Is that something you anticipated?
I think one of the things about Wikipedia that is really powerful is it's not just that I have a sense of responsibility to readers or that the folks who work at the Wikimedia Foundation have a sense of responsibility to readers. It's that there are 250,000 editors every single month on Wikipedia who feel a responsibility to readers globally and millions of editors over time. And so I think that also allows for Wikipedia to say it's not just one community standard. We actually have a very different set of standards for medical information than we do across the projects as a whole. And again, that's really set by a global editing community of volunteers who come from, very often have medical backgrounds, research, academic, clinical backgrounds. We're able to take a look at that information and say, really, that doesn't cut it. What we're looking at is something like 175 languages.
And I kind of want to end on this idea of what people in the audience, how they should interact or feel what they would want to contribute to Wikipedia if they do. And
for everyone in the audience today, just continue to be a critical learner and a critical knowledge seeker. Wikipedia and the Wikimedia Foundation have presences all over the globe through local communities, chapters, and clubs that are more than happy to work with you, your institution, to make more knowledge available. That is our goal. That is our only mission. That is our only aspiration, is to make more knowledge available to the world and to enable everyone to participate in its creation. So that's my answer is click edit, find a group that is in your local area, find an area of passion for you, and please help make the world a more informed and better place.
Please welcome the Union's TB Ambassador, Claire FORLANI.
Good afternoon. I'm honored to be here today and to speak with these distinguished guests and all the committed people trying to make a difference in the tuberculosis epidemic in these testing and very, very trying times. It's been a year since I was in Hyderabad, India, at last year's conference, spending time with people who have survived TB and who continue to raise awareness of the disease. These people are extraordinary. They are inspiring, and their ability to educate us is integral to bringing an end to this debilitating and horrific disease. Hyderabad opened my eyes in so many ways. speaking with the TB survivors from around the world, taught me that in fact, to end any kind of epidemic, you need community to be upfront and center of the response. 12 months later, in the middle of the COVID-19 pandemic, I believe this to be truer than ever. The horrific pandemic is disproportionately affecting the poor and the vulnerable, those people living with pre-existing conditions, those people living with chronic diseases such as diabetes and hypertension, migrant workers, people working on the front line who just cannot afford not to work. And yet the voices of these communities have been largely stifled in many countries across the globe, or totally silenced. This has to change. Both the HIV and TB responses have shown that we need community to partner with the scientific community, uphold the sanctity of evidence-based policy, and hold governments at all levels accountable when they are making decisions that affect the lives of their citizens. Contact tracing and testing are not new. They are, in fact, directly from the TB playbook. If the people we vote for are not getting the tracing and the testing right, we need those most affected to be at the table and to call the decision makers out. And going forward, we are convinced in the TB community that if we are to deliver safe and equitable vaccines, we have to insist that the community is part of the equation, both in their oversight, but also in their delivery around the world. Today, TB doesn't yet have an effective vaccine, but it is preventable, treatable, and curable. And yet for years and years now, the disease has been needlessly killing 4,000 people a day. That's right. 1.5 million people die each year from TB. But governments aren't listening. This, it seems, is not a headline-worthy topic. And TB deserves headlines. Maybe COVID-19 pandemic will deliver the most urgent one. Government, invest in the health of all your citizens. Thank you, and we can only hope that this reverberates. Thank you and enjoy your Union World Conference.
When I say the word TB, what comes to mind? Do you get afraid? Do you think that it may be the end? Or do you hit a panic and check if you're short of breath? Well, I'm here to tell you that your reaction should not be one of fear or despair. Hello everyone, I'm Tamron Green and I'm a tuberculosis survivor. In the fight to achieving a tuberculosis-free world, I've had to come to terms with certain truths. And I've had to educate myself regarding the facts around this disease. After noticing a lump in my neck, I knew something was wrong and I had to go to a doctor. I went to my GP, and after performing a number of tests, including an excision biopsy of my lump, I was told that I had pulmonary tuberculosis. It was quite the surprise. Throughout my journey, I had many ups and downs with the treatment, re-diagnoses, and the hiding of my status. I suffered alone at the hands of the stigma and shame associated with this disease. And much like myself, there are many people that have to endure the trauma of dealing with this situation alone. This is a lot to do with the alienation, judgment, and misconceptions associated with the disease. Suffering at the hands of the fear of being ostracized could have been avoided had I known that the recovery process with TB and the cure for TB was possible, and that there was no reason to be shy. Earlier treatment could have been achieved if I spoke up about my infection earlier. And because of this, I've decided to fly my flag high in support of awareness, not only for tuberculosis, but also to encourage everyone to reveal their status. This will not only help them, but also the people around them. I think educating those around you and in extension, the world at large, is one of the greatest gifts you can give to someone who has been affected by tuberculosis. Throughout my personal journey of healing and emotional recovery, I find confidence in knowing that I'm not alone. Being a survivor of this disease has made me a stronger person, and it has allowed me to face new challenges with my head held high. Let's break the stigma, hand in hand, side by side, and let's defeat this disease and see a brighter tomorrow. Thank you for taking the time to have me share my story. And I know that when you share your story, you will not only inspire others, but you will also allow them to know that we're all in this together, as one. Thank you.
Thank you, Dr. Tamarin Green, for sharing your inspiring story with us. Thank you also to all our distinguished speakers and guests for joining us for this opening ceremony. Honoured guests and friends, you heard today about the remarkable history of the Union. You have also heard something of the major challenges we all face now, finishing the job that we started 100 years ago and finally ending TB, dealing with the new threat of COVID-19 and other airborne threats to health, including both known and as yet unknown infectious agents, air pollution, smoke from forest fires and agricultural burning, tobacco products and workplace hazards. We have heard about asthma, COPD and pneumonia, common diseases for which effective treatment is available. However, too many of the world's population do not have access to those treatments. Recognising these problems is only half the battle. We need to find and implement solutions. I am here today to tell you that the Union is uniquely placed to identify those solutions and to lead the fight against all these threats. Our vision is a healthier world for all, free of tuberculosis and lung disease. We are a membership organisation, a technical organisation, and a scientific organisation. Our members are from all parts of the world. We are made up of government and non-government agencies, charities, donors and funders, professional groups, patient groups, and civil society organisations. We bring together clinicians, managers, policymakers, frontline workers and implementers, scientists, patients and survivors, advocates, and civil society. Our mission is to end suffering due to tuberculosis and lung diseases, old and new, by advancing better prevention and care. We seek to achieve this by the generation, dissemination, and implementation of knowledge into policy and practice. We aim to ensure that no one is left behind, people are treated equally, and we have a focus on vulnerable and marginalised populations and communities. I humbly and respectfully submit that the Union is uniquely placed to achieve this mission and urge conference delegates to join our movement and become a part of our global community of members. It is now my distinct honour and privilege to introduce our final speaker. You will all know him as a tireless champion of public health, both in his own country and around the world. Please join me in welcoming President Bill Clinton, founder and board chair of the Clinton Foundation and 42nd President of the United States of America.
I'm proud to join all of you for the 51st Union World Conference on Lung Health. I'd like to acknowledge Her Imperial Highness, Crown Princess Akashino, and the many honored guests participating today. I'd also like to thank Professor Guy Marks, José Luis Castro, and everyone at the Union for your remarkable work in the fight against tuberculosis and lung disease. And of course, I want to acknowledge and thank my longtime friend, Dr. Tedros, for our many years of work together and for the leadership he's shown, most recently in responding to the COVID-19 pandemic as Director General of the World Health Organization. I'm very grateful that the Clinton Health Access Initiative has had the chance to work closely with the WHO to help procure and ship emergency supplies to low and middle income countries, and to continue to work with a wide range of partners on many facets of the pandemic, especially in Africa. This conference is coming at an important time. COVID-19 has already claimed the lives of more than 1 million people around the world, crippled national economies and the global economy, and disrupted the ways we live and work, as well as how we deliver and receive health care. As everyone at this meeting knows all too well, this disruption has taken a heavy toll on other healthcare efforts, including existing efforts to prevent, diagnose, and treat TB, especially in low and moderate income countries. With already scarce medical resources being diverted toward the fight against COVID, lockdowns and other restrictions on movement preventing patients from accessing routine treatment and diagnostics, and people spending more time in crowded households, we're seeing an increase in TB transmission that threatens to reverse the progress we've made in recent years and put millions more at risk. And since TB only recently started at long last to receive the kind of global attention it deserves, we cannot afford to make this devastating setback permanent. Because this crisis also gives us a chance to totally reimagine what our future will look like, what our societies, our economies, and our healthcare systems look like, and how we relate to one another. The path to an optimal post-COVID world is unlikely to be simple or quick, but we cannot simply revert to the status quo, where we have insufficient efforts to find and treat people with TB and keep them on treatment, where our public health response to different illnesses takes place in silos rather than comprehensive systems that focus on the whole person, and where we lack the vision and political will to properly fund global health programs. We need to seize this moment to make investments in sustainable, comprehensive lung health programs, not just to get the pandemic under control, but to eliminate COVID-19 and to eliminate tuberculosis, while improving treatment for all other pulmonary illnesses. When I was president long ago, I was especially proud that 43 million more Americans were breathing air that met the highest quality standards when I left office than when I took office. We've got to keep working on this. First, we have to find ways to minimize disruptions in essential health services during potential new waves of COVID. One key here will be protecting the workers on the front line of TB care by ensuring that they have access to COVID-19 tests, PPE, and other resources so they can continue their important work. As testing capacity for COVID continues to scale up worldwide, we should leverage these gains to find more cases of TB. As people are assessed for COVID-19 in clinics, especially in low and middle income countries, there are opportunities also to test their TB status and to start them on treatment. And TB diagnostic technologies and development may also make it easier and cheaper to test people more widely. I know the challenges we face are daunting, but if we come together with a coordinated, creative response, with the resources and will to support, we can save lives today and for years to come. And you can be winning again in this big battle. Thank you for your extraordinary work. Have a good conference and let's keep at it.
Thank you to President Clinton and all our distinguished guests. The 51st Union World Conference on Lung Health is now open. Thank you for joining us.